Often, when I meet a new patient and ask them about their medical history, they'll say something like, I was diagnosed with dermatitis. And usually they pause, waiting for me to react or acknowledge it. But here's the thing, dermatitis is actually a very general, and I would say even generic term. It simply means inflammation of the skin. But what's causing that inflammation? That's the key. Without identifying the specific type of dermatitis, the term itself doesn't tell us much. And without knowing the root cause, it's hard to treat it effectively. So let's talk about dermatitis. Dermatitis isn't a single condition, it's a broad category that includes many different skin issues. Each type has its own causes, symptoms, and treatment. For example, some types are triggered by allergens, while others result from infections, and some others result from poor circulation. So when someone says they have dermatitis, the real question is what kind of dermatitis? And that's what usually I say in response, because that's what determines the best treatment plan. Welcome back. I'm Dr. Maria Azizian, a board certified general surgeon and IFM-certified functional medicine physician. On this channel, I share health tips on skin health, food and supplements, functional medicine, and the latest medical research to help you feel your best. And if that sounds good, please like, share with your friends, and subscribe. So, let's talk about common types of dermatitis. There's so many of them that we won't be able to talk about all of them. But let's start with atopic dermatitis. To put it simply, it is another name for eczema. And atopic dermatitis or eczema is a chronic inflammatory condition often linked to genetics, immune system overactivity, and skin barrier dysfunction. And it typically starts in childhood and can persist into adulthood. Atopic dermatitis often appears as red, itchy, and dry patches commonly found on face, hands, elbows, and knees. Common triggers may include allergens like dust mites, pollen, pet dander, certain foods, stress, that's a big one, and environmental irritants. In fact, foods are very common triggers for eczema or atopic dermatitis. I go through 12 types of food groups that may cause it in my book, The Clear Skin Diet, Unlocking the Secret Link Between Food Sensitivities and Skin Health. Examples of atopic dermatitis include infantile eczema, that is common in babies, of course, or adult atopic dermatitis that refers to chronic and recurring eczema. Another one is dyshydrotic eczema, presents as small, itchy blisters on hands and feet. The treatment focus is strengthening the skin barrier with moisturizers and identifying and avoiding triggers. In conventional medicine, we reduce inflammation with topical steroids or calcineurin inhibitors. However, in functional medicine, we look for root cause that is often tied in to our gut or hormonal issues or both. The next type of dermatitis is infectious dermatitis. Infectious dermatitis is caused by bacteria, viruses, or fungi. Here, the bacteria directly invades the skin, so it's actually not subtle. And some types and examples: bacterial dermatitis, impetigo, highly contagious with honey-colored crust that is mostly seen in children. Then we have cellulitis, another commonly thrown term that literally means infection of the skin. And along the same lines, there's folliculitis, that is an infection of the hair follicles of the skin. The next type of infections is viral. And here we have herpes simplex or cold sores, or varicella zoster, presents as shingles in elderly and immunocompromised, or chickenpox, mostly in children. Then another one is molluscum contagiosum or waterworts. Just to get back to our topic, all these are dermatitis. So you already see how much variety and variability, I would say, there is in this term, and we're not even done yet. So amongst infectious dermatitis, there is fungal dermatitis, such as tinea or ringworm, candidiasis or yeast infection, and athlete's foot. And here, our treatment focus is antimicrobial treatment specific to the type of the infection. Antibiotics for bacterial infections, antivirals, if applicable, for viral infections, and antifungals for fungal infections. treating the infection itself is crucial, as using the wrong treatment, like, for example, if you use steroids for infectious conditions, can sometimes make the condition much worse. So all dermatitis are not the same. The next separate dermatitis category is contact dermatitis. This occurs when your skin reacts to something it touches, either due to an irritant or an allergic reaction. The rash usually appears at the site of contact and can be red, itchy, and sometimes blistered. There are two ways this can happen. So there's irritant contact dermatitis, and it is caused by direct damage from substances like soaps, detergents, or chemicals. For example, you use a hand soap at the hotel that you just checked in, and you develop redness and itching on your hands. Or another common situation when using a new makeup, lipstick, or mascara, and you develop issues at the exact site where you use the new product. But other way of contact dermatitis is presenting as an allergic contact dermatitis. It is caused by an immune reaction to allergens like poison ivy, nickel, latex, or fragrances. Examples include poison ivy or poison oak, rash, nickel allergy common from jewelry or belt buckles, and latex allergy common in healthcare workers. The treatment focus here is relatively easy. Remove or avoid the trigger, soothe the skin with moisturizers and antihistamines, and reduce inflammation with topical steroids short term. Our next category of dermatitis is seborrheic dermatitis. This type affects areas of the skin with more oil glands like the scalp, face, and chest. It's linked to a type of yeast called Malassezia, which lives naturally on the skin but sometimes can overgrow and cause inflammation. Symptoms are red, greasy, and scaly patches with white or yellowish flakes, which look like, I call it face dandruff. On the scalp, it often appears as dandruff. That's what we actually call dandruff. And here are the examples of adult seborrheic dermatitis, common in adults, especially on the scalp, eyebrows, and also around the nose, like this perioral area. And the cradle cap, that's a harmless temporary condition in infants and newborns. The treatment focus is antifungal shampoos like ketoconazole or selenium sulfide, anti-inflammatory creams, and gentle skincare to reduce this oil buildup. My last examples of dermatitis is another common type that is called stasis dermatitis. Stasis dermatitis is caused by poor circulation, usually in the legs, leading to fluid buildup and skin inflammation. Over time, this can cause the skin to become discolored, thickened, and prone to ulcers. Common causes: chronic venous insufficiency, varicose veins, and prolonged standing or sitting. Symptoms include redness, swelling, itching, and brownish discoloration on the lower legs. We see that a lot during our routine skin checks. In severe cases, skin ulcers may form. Treatment focus is improving circulation through compression stockings, leg elevation, and sometimes vein surgery. So as you can see, each type of dermatitis has a different root cause, and that's why labeling it as dermatitis just isn't enough. For example, applying a steroid cream may help with atopic dermatitis, eczema, but it could worsen infectious dermatitis. Likewise, moisturizing helps with eczema, but won't solve stasis dermatitis unless the underlying circulation problem is addressed. It may make it a little better though. So how do we identify the type? Diagnosing the exact type of dermatitis involves looking at several factors: when it started, where on the body it appears, what triggers it, and any other health conditions that you have. That's very important. Sometimes tests like patch testing for allergies, skin biopsies, or blood work may be needed. So as a doctor, in some cases of dermatitis, you have to be a detective and get a very good and extensive history to come up with your top reasons for the patient's dermatitis. I often spend a long time on having the patient remember what happened at the onset of dermatitis or what preceded it. Were they traveling, or did they change their hygiene products or bed sheets? And the list goes on. In conclusion, if you have been told you have dermatitis, the next step is figuring out what type it is and what's causing it. Your doctor should be your fellow detective in this process. And that's the only way to get the right treatment and the lasting relief. And remember, your skin is telling you something. Finding the root cause is the key to solving the problem, not just covering it up. Thank you so much for watching. Please share your thoughts in the comments. Until next time, bye-bye.